she sees me up on trees cutting down stuff with it, like a chainsaw or whatever. And she's like, you're a surgeon. Think about your hands, I don't think we can bouncy here, but it bounces way more than you think. It's like somewhere between a bowling ball and a basketball.
There you go. Yeah.
That's pretty good.
We're off script. Hello and welcome to Off Script. Here at Oswego Health, we like to take you behind the scenes with the healthcare team that takes care of you. Today, we are honored to have Dr. Michael Danise with us. Welcome.
Good to be here.
Oh, handshake. I love it. We're already off to a great start. Because we are with a general surgeon today, I would like to discuss our plan for our first incision by laying out what we're going to go through today.
Okay.
So I'm going to start with a very, very pressing question that I have for you.
Okay.
And we're going to see where the conversation takes us from there. At the end, I'm going to have some rapid fire questions for you. And then if you survive for those rapid fire questions, your gift from me to you is the opportunity to ask me any question that you want.
Okay.
Are you ready for some surgery?
Let's do it.
Let's rock. My first pressing question. It's reality versus television. Now, I grew up watching shows such as ER, House. You watch the surgeries. There's blood flying all over the place.
Yeah.
You have the surgeon yelling at the team. No matter how good the surgeon is, something always goes wrong. But in the end, success at a surgery that's never been performed before.
Yeah.
Is real surgery anything remotely close to what they have on TV?
So, there are surgeries, there's big traumas that are certainly bloody and, hectic and chaotic situations. But most of what I do is outpatient surgery, which thankfully is much calmer and very little blood, if any. So it's a less stressful environment for sure than you see on TV.
I love those on TV. They're so good, though. They're so good.
Yeah.
So on TV, it always looks like one surgeon does everything. And in real life, how many people are actually in the operating room?
That's a funny question. So there's usually me. I have an assistant, which is usually one of the surgical PAs. And we do most of the surgery together, and they'll hold or retract things for me and assist me. And then there's a nurse that's sterile. And they'll hand instruments and keep track of the sterility. There's a nurse that's not sterile, and they'll get something from the closet if we need it, and do all the charting. There's an anesthesiologist sometimes, and then a few other extra people here and there. So there's pretty good amount. And I always joke with patients, we do these procedures called fine needle aspirations, little biopsies, and we have it's just a poke with a needle. That's the whole procedure. And it's me, a nurse, someone giving anesthesia, the pathology tech to make the slides, an ultrasound tech, the pathologist, and the patient. I think I counted, it was like 9 or 10 people in a room for a little needle poke at one point.
I love it. So I equate that to football is what I love. You as the surgeon would be the quarterback.
Yeah.
And the rest of the team has their place, which is very, very important.
Yeah. Yeah. Everybody has a role for sure. And it's, part of my job is to coordinate everything and, set a tone for the room, and make sure that everybody's on the same page. Yeah.
Do you personally have a favorite surgery that you've ever done?
So every surgery is a little different, and I like different things about all the surgeries that I do. Elective surgery is fun because it's usually a little calmer and a less stressful day. But emergency surgery is interesting to me too as well, because you're making an immediate difference. Somebody comes into the emergency room and they really need surgery right away, and you sweep them off to the operating room, you fix their problem, and sometimes you save their life, and it's a totally different feeling than elective surgery, but they're both fun.
That's awesome. So we talked about it a little, where you're talking about the nursing staff with sterilization.
Yeah.
we are so excited to have the Da Vinci robot
Yeah.
here, right?
Yeah.
Tell me a little bit more about the robot, how it functions, and how we use it here at Oswego Health.
Every year, the technology we use in surgery is just improving and getting better, and better for the patients, better for the surgeons, better for everybody. And, decades ago, we'd do big open surgery. I do mostly abdominal surgery. So, we make big incisions, and it'd be a long recovery, long time in the hospital, and a lot of pain for patients. And then, the next evolution of that was laparoscopic surgery, where we'd do small incisions. But I always describe it to patients as operating with chopsticks. So we're making these incisions, putting these ports in, and the surgeon's like a little T-Rex almost trying to take stuff out. And surgeons are really good at doing it, but it's not very elegant. And so the next evolution of that, we've been doing more and more lately is robotic surgery, which is usually similar. The steps of the surgery are very similar to laparoscopic surgery, but for most surgeries. But it's instead of chopsticks, you have arms that move like this. It's a little more elegant, a little better tissue handling, and the camera's better, and everything's a little nicer. And the surgeon gets to sit, which is always nice for the surgeon.
It's always great. It's always great. When I was in there to watch, you were at a console. So you started at the patient with as we talked about, the first incision, and then everything was set. Then you moved over to the console. That was amazing to me to watch.
Yeah.
You were a conductor, it looked like to me, and able to orchestrate the arms of the robot, which were about 3 to 5 feet away. It was awesome. So just explain that process.
Yeah. So we start every robotic surgery by putting ports into the patient.
What a port would be?
Port is like a metal tube that we can pass instruments through, and we connect the robotic arms to that. And then we use those instruments and cameras that go through those ports to do the surgery.
So they slide right through.
They slide right in there, and then after everything is kind of set up, my assistant stays at the patient's bedside, and I go over to the same room. It's just a couple feet over to the side. We have the console, and that's a nice big 3D headset. It has 3D vision and arm controls and foot pedals, and it's a little like a video game almost. The robot doesn't do anything on its own. It's just everything is controlled by me. All the motion is controlled by me. So I'll move my arm on the hand grip of the console, and the robotic arm mirrors my motion on the patient. So it's a little like someone like you that comes in, they just see me over in the corner like this, and the robot's over on the patient doing its thing, but I'm controlling everything that's happening.
And the advantages to the robot are obviously you can perform the surgery at a much more proficient way, but recovery for patients is easier too also, right?
Certainly more easier recovery than a big incision, big open incision. When you compare a minimally invasive surgery like laparoscopic or robotic to an open incision, it's much less pain, faster recovery, less time in the hospital. When you compare those, for sure.
And then last question on this topic, then we will transition.
All right.
What types of procedures do you commonly do with the robot?
Yeah, so I do most surgeries in the abdomen with the robotic platform at this point. I do almost all gallbladders with the robotic platform. Almost all hernias, if we're doing them in the abdomen and not an open incision. And some emergency surgeries, ulcers that are perforated, we do on the robot. I still do mostly laparoscopic surgery for things like appendix surgery, but occasionally I'll do that on the robot too if I'm worried for some reason about something specific.
So for people meeting you for the first time, describe how you would describe yourself outside the OR. So Dr. Danise, outside of work.
Yeah. So most of my time outside of work is with my family. So we live right here in town. I live by the golf course. I have a wife and 2 kids. I have a daughter that's 3, and my son is going to turn 1 at the end of the month. So most of my time is at home with them and playing and reading and stuff like that.
Cool. So around here, you're known as a pretty down-to-earth guy and a family man. So where does that come from?
So, family's always been a big part of my life. I grew up a little bit east of here in a little town, Gloversville, New York. It's closer towards Albany.
No, I see it on the thruway every
Yeah,
time I drive.
I-90, yeah, right down there. Yeah. And I met my wife in high school, or before high school. We started dating in high school. So our families are, very close to each other. So when we go home for the holidays, everybody's kind of right there. And yeah, it's always just been a big part of my life. Yeah.
Cool. My father-in-law, I've known him for eons. He was my football coach in high school. So I've known
Oh,
my
that's
wife
tough.
for a long time. So I know, yeah. So I was a coach. I'm like, you're not my coach. So you can't really tell me that's right. If I'm a patient, brand new patient to Oswego Health, meeting you, Dr. Danise, for the first time, what should a patient expect?
A lot of times when I meet patients for the first time, they come into my office and they've been told by somebody, sometimes it's the emergency room doctor, sometimes it's their primary care doctor, you have to see a surgeon, you need surgery for this, and then they end up in my office. Sometimes people think they're getting surgery that day when they see me in the office. Part of my process of meeting the patient, a lot of times they don't need surgery. They've talked to somebody and they come in thinking, oh my goodness, I need surgery. And they're just very stressed about everything. And to me, most of the things that I see in the office are elective surgeries. And so it's not that you absolutely need surgery, absolutely don't need surgery. It's a discussion with the patient. And we talked about the risks of surgery. Every surgery has risks. Every surgery is scary. We talk about the benefits of surgery. We talk about what their symptoms are. A lot of times the surgeries that we do are for pain, whether that be, pain from a hernia, pain from a gallbladder. And, we talk about their symptoms and how much their pain is bothering them, how likely I think that pain will improve after a surgery. And sometimes we decide, we're not going to do surgery. We're going to wait a little bit, or we'll just keep an eye on things. And, for somebody that has come in and I need surgery, I'm really stressed about this. It doesn't really bother me that much. I don't know why somebody's telling me I need surgery. It's a big discussion in the office of trying to figure out what's right for every individual patient, and not just, you need surgery, let's do it, let's schedule it. It's a discussion. So that's what I try to do. I try to tailor everything to every individual patient. Everybody's a little different. Everybody has different fears. Everybody has different, different lives. And that should, in my mind, be individualized to every patient.
Yeah. So I view that as you seeing the patient more than the problem itself.
Yeah.
Right?
Yeah. You can come with you can come in with a groin hernia, and not all groin hernias need to be fixed. And that's part of when I meet a patient, is trying to get a sense of who they are and what they're feeling. And we talk about all the options, and then we come up with a plan together.
Awesome. So for someone who has never seen surgery before, what would surprise them most about the operating room?
So, all the technology is really cool. The sterility process is interesting to somebody who's never seen it before. I think also the fact, we do kind of, for the people that are in the operating room, that's their job. And so we kind of talk and chit chat a little bit during, the non-critical portions of surgeries. And so parts of the surgery are, pretty relaxed, and we're talking like it's a normal job amongst ourselves.
When I witnessed, you were a well-oiled machine. It was fantastic.
Yeah.
So a typical surgery day, what does it look like for you?
So part of the fun part about being a general surgeon is that every day is a little bit different. So, some days I'm in the clinic mostly, but on a surgery day, I could have 5 surgeries, and they could be 5 different surgeries. I'm not doing the same thing every surgery. It's a good mix. And so, every surgery day is a little different. And sometimes we have emergency surgeries, and so that kind of throws a wrench in plans sometimes, and we gotta, call an audible. But it's we figure it out, and everybody gets what they need.
Explain the difference in preparation between an elective and then an emergent surgery.
Well, an elective surgery, it's just, usually a little bit more planning. If they need to be optimized more before surgery, if they have any issues, their primary care doctor can, make sure they're doing okay before surgery. And, we can pick a date. And most surgeries I do are outpatient. So patients go home right after surgery, and they don't have to spend any time in the hospital, overnight in the hospital. And emergency surgeries are, there's different levels of emergency surgery, and some are really emergency and you have to go as soon as possible. And it's a little more urgency and not necessarily chaos, but focus and trying to get everything done as quickly as possible as we can.
Explain your process for focusing.
So a lot of it is for me right before surgery. We scrub, so I'm at the sink, and it's a good time. It's a 3-minute period, and I'm not talking to anybody. I'm kind of visualizing what surgery is going to be like, thinking of any problems that I may encounter and how I would deal with them. I usually say a little prayer, and just trying to just get as focused as I can. A lot of times, as I said, I'm getting bombarded with questions from all different angles during the day. And when I'm scrubbing, I'm blocking everything else out and my focus goes right to the patient. And that's all I'm thinking about at that point. And all the rest of the chaos of my life is fading away into the background.
Yeah, that reminds me a lot of, I forget the name of the movie, but Kevin Costner was pitching for the Detroit Tigers against the Yankees. And he threw a perfect game in the movie, and the stadium was all chaos around him. And then he just kept saying, clear the mechanism, clear focus. And then the whole stadium went silent so he could pitch. So I equate that a lot to that. So early influences and background, right?
Okay.
So I heard you still help your father with electrical work. Are you talking small projects or full wiring jobs?
Yeah, my dad is a union electrician.
Oh, okay.
Yep, he's retired now. So, but I think in some sense I'm still, the 12-year-old kid that was helping him. He's still, be careful how you're holding that. It's still a lot of that. Even though
DIY, I like electrical. I don't touch.
No, we do a lot of projects around my house. I like, in my brother's house and my dad's house, we go all do stuff all over the place. Yeah.
So you've always liked working with your hands then?
Yeah, there's a lot of similarities actually between surgery and
that was one of my questions. So
it's really
answer lovely.
It's pulling wires and the way that he thinks about things. There's definitely some similarities between, especially I don't do vascular surgery anymore, but I did it a lot in residency, and there's a lot of similarities between those two. It's just wiring.
So your medical training. So you went to medical school, University of Buffalo.
Yeah.
And which I share that with you.
Yeah.
Go Bulls, right? Tell me a little bit about that experience.
That I love my time in med school. That was I got great training. Is really, med school is not like undergrad at all. It's a lot more self-study. You're in lecture every day for the first couple of years. But it's only for a couple of hours every day. And after that, you got to go home and learn whatever they talked about for the last couple of hours, and they go to the next thing the next day. So if you don't have the first day down, you're going to be lost. So I always love that. I love going home and memorizing pathways, and some people hate that part of med school, but I always found it fascinating. So it's sitting by yourself in a room with some snacks and a beanbag chair and trying to cram all this stuff in, and that's kind of the first half of med school. And then the second half of med school is as patient stuff. So you're going to the hospital more, and you do your rotations and you see all the specialties and primary care and what everything's like. And that's when you start picking what you want to do.
What drew you to general surgery?
Yeah, I had went into med school thinking that I wanted to do surgery. General surgery is a very broad category, and you can do a lot of different kinds of surgery out of general surgery. You can't do ortho and you can't do neurosurgery, but all the other branches of surgery you can generally get to from general surgery. So I had gone into med school thinking I wanted to do surgery, and general surgery was the broadest choice to keep your options open. And then you get to third year and you start your general surgery rotation. You're like, this is it. Am I going to like this or not? And it was great. I worked harder on my general surgery rotation than I did on any other rotation. I was there before, 6 a.m. I would have stayed all day, leave at 6 or 7 p.m. And, but the day went by faster than any other rotation that I did. Some people, when they do their medicine rotation, they love that side of things. That's a lot more, sitting around and talking about patients on a big table and deciding what medications you're going to do for the day, or what the plan is for the day. And surgeries, you're just doing surgery, 4 or 5 surgeries in a day. Those medicine rotations went so slow for me. God bless those medicine doctors. But they dragged on, and I was just looking at my watch the whole day. And then my surgery rotation, it just flew by. I knew this is what I got to do.
So what did you learn techniques on, like fruit?
Yeah, you see a lot of that, don't you? On like
Another TV thing.
Yeah, you see them practicing on the bananas and the oranges. Yeah. It's a okay way to do it, I think. But if you're at a teaching hospital, they will hand the med student they'll let the med student close.
So practicing is doing
first day as a med student. So
wow.
Yeah, I mean, somebody's watching them, obviously, but that skin tissue is a lot different than an orange. So you can learn what the stitch is supposed to look like, and where the needle's supposed to go in, and where it's supposed to come out, and how you can tie it. But the getting it to look nice on an incision is way different. And the only way to do it is to do it like any surgery. At some point you have to do it for your first time.
Yeah.
And you have assistants, and you've seen them done a lot of times, and you know all the steps, but at some point you got to jump in.
Was it see, do,
see one,
teach.
Do, and teach one?
Yeah,
that's
I wasn't too far off.
Yeah, see one, do, and teach one.
Do you have a favorite professor or mentor?
Oh, I have a lot. I've taken so many things from a lot of my attendings, especially in residency. I've learned, I'm the way that I do surgery is I take a little bit from the way this person does it, and a little bit from the way this person does it. And that's part of residency, is you're trying to see how, you've seen the surgery done by 50 different people, and you've seen what you like, you've seen what you don't like, you've seen what, works well, what doesn't work well, where people run into problems. And you kind of synthesize all of that, and you take the best parts of everybody and you make it your own, and that's how you do it from now on. And that's one of the fun parts of residency.
And since you brought up residency, it's been an absolute pleasure for me to go around the community to tell people that we have a trained physician that went to Brown.
Yeah,
that is phenomenal for me to tell, and see people look back at me. Tell me about that experience.
Residency, it was some of the hardest but some of the best years of my life. It's extremely fun. I get you make lifelong friendships, and you become who you're going to be as a surgeon, and it is extremely hard. I would not recommend it to anybody, but it is very rewarding, and I had a great time at Brown.
And when you finished, you came here with hundreds of surgeries already under your belt on the rope.
More than hundreds. Oh yeah. No, you
don't let me undersell you.
In the thousands during residency. That's how you, like we talked about, you have to do surgery at some point, but then the excellence in surgery is just doing it over and over and over and over again. And that's how you get good.
So transitioning here was just like any other day.
Right? It's a lot different than residency.
Okay, explain that.
Yeah. So I was at a big hospital, level 1 trauma center. We did everything. We had, the surgery department was many surgeons. And here it's 2 surgeons that do the general surgery department. We don't have it's a smaller hospital. It's a completely different environment, and there are some things that we can't do here that are, need to be at a bigger hospital, and it's just a different type of surgery. Yeah.
Since we opened up Oswego Health, why did you choose Oswego Health?
So I'm from a small town. I've always been a small town guy. I've always shied away from the bigger cities. I did med school in Buffalo and was in Providence. So both kind of, you always have to be in somewhat of a bigger city for medical training, because that's where all the big that's where all the teaching hospitals are.
I
But
always call Buffalo a big, small city.
yeah, it's not a big city by any means, and I always shied away from the New Yorks and the Bostons because I wanted to be as small as I possibly could while still, getting good training. And so my plan was always to come back and do general surgery in a smaller area. And then I interviewed here, and it's a beautiful little town.
Oswego's
It's
awesome.
it's awesome. So, I thought it would be a good place to raise my family, and yeah, so I was happy to come here.
We're happy to have you. So what do you enjoy most about working in a community-based healthcare system?
I like that I know all the doctors. Yeah, when you're in a bigger healthcare setting, you don't know who's sending you patients. You don't know who to send patients to. You just, I want to send them to this specialty, and that's it's tough to build relationships with other doctors as easily, and with all the other doctors. And here I know who's sending me patients. I can pick them up and call them on the phone and chat with them about something if I have a problem or question. And it's a lot more cohesive.
So what does it mean to take care of patients who truly are your neighbors?
Yeah. So, like I said, I live in the community. I am right in the city. I live 4 minutes from the hospital. I have seen patients all over town. It's always fun. I see them at Lowe's. I see them at Walmart. I've seen them, all over the place. And it's they'll hear my name, and I'll look over and hey,
You're at Lowe's for another project, right?
yeah. So it's always fun. We catch up for a few minutes. I say, how you doing, and make sure everything's going okay. But it's fun, and that's the reward of it being in a smaller place, is that I feel that I actually am helping the community, and seeing a difference, and seeing people around that have been helped. So it's fun.
Perfect. I asked you to bring in some items that represent who you are.
Yeah.
So I have a couple next to me. This first one I'm starting with is the most intriguing. It is this lovely, I can't even palm it.
It's heavier than you think.
Yes, it is. This lovely ball of rubber bands. And the first thing I think of is the rubber band man.
Yeah. So what do you think it is? What do you think it is? What do you think the significance is?
Obviously a ball of rubber bands.
Yeah. So this was a rubber band ball that I started in residency. And
I like that.
when we had, whenever you do a surgery, or most surgeries, we put little things on the patient's leg to help prevent blood clots. And there's some tubing on it. And every tubing would have a rubber band on it.
Are those the rubber bands used?
Those are the rubber bands. So every surgery I would do, I'd take the rubber band off. And then we started making a ball. I started like maybe my 3rd year residency. And so, and then eventually grew, and my co-residents would take the rubber bands when they did surgery, and I'd have a bin in the room, the residency room, and they'd throw them all in there. And
so this was since 3rd year residency?
Yeah. So it was a long time.
Do you roughly know how many?
At one point we broke out a scale and weighed 100 rubber bands, and then weighed the ball and tried to figure out how many were in the ball based on that, and back to that.
It's incredible.
Yes.
That's how many surgeries you've done.
Lot.
That's a lot.
It's a lot of surgery. It's really it bounces. I don't think we can bounce it here, but it bounces way more than you think. It's like somewhere between a bowling ball and a basketball. Really? And so a lot of people, they're like, this isn't gonna bounce in. So I say bounce it, and it bounces in. So they almost hit someone in the face.
I kind of want to. There you go. Yeah.
That's pretty good.
We're off script. Right. Our next item is this lovely bottle of grape soda, I believe. Correct?
Yeah.
So
read the tag.
Hold it up, right? I did, right there. Soda.
No, yeah, that's not the tag. That's the label.
Oh, the tag here? Thank you. Oh, is this from your wedding?
Yes.
Ah,
This
there
is
you
from my
go.
wedding.
So a favor then, right? Yeah.
Yeah. So this is what we gave the guests at my wedding. So
Thanks for the invite, by the way.
yeah, no problem.
Yeah.
So I had my wedding was in Saratoga because that's where my wife and I are from, that area, and so our
I love
families were all there.
Saratoga. Yeah.
Yeah. So and then this is sort of from Rhode Island.
Where was it at?
I don't remember the name of the building, but
We'll cross that off.
yeah, just cut that out.
Yeah, yeah.
Sorry, honey.
Then, bend over. We have this huge Dr. Danise pen. I feel like I'm on QVC.
Yeah.
Yeah. Tell me about the pen.
So the pen. So every time before you do a surgery, I meet with the patients right before surgery in the preoperative area, and I have to do some paperwork, and I have to sign my name and say that everything looks good and we're ready to go for surgery. And so I would walk in every morning with my cup of coffee, and I'd have to sign my name, and I'd never have a pen, and I always lose my pens. And it take forever. And I had to go running around. Do you have a pen I can borrow? Do you have a pen? And so I walked in one day, and they had these giant pens with my name on them sitting there.
Awesome. Yeah.
And they made 3 of them for me. And so I haven't lost one since. It's been several months at this point, and we're still going strong. We still got all 3. And they're giant with my name on them, so it's tough to lose. All the other surgeons are a little jealous too.
And
so
you can't forget your name.
That's right. Yeah,
All right, Dr. Danise, are you ready for a rapid fire question?
Let's do it.
All right, let's go. Favorite buffalo food, wings or beef on weck?
Wings.
Wings. Good call. Favorite comfort food after a long day?
Whatever my wife made that night. She always makes me dinner. I'm just
Good call.
She has.
So between surgery, electrical work, what are you basically the guy everyone calls when something breaks?
So anything around my house, certainly I'll fix that.
Where's the line drawn?
Where's the line drawn?
When you make that call?
Sometimes my wife, I'm sure, thinks I should draw the line a little sooner. She sees me up on trees cutting down stuff with it, like a chainsaw or whatever, and she's like, "You're a surgeon. Think about your hands."
Yeah.
So she, I'm sure, wants me to do less, but yeah.
Most unrealistic thing you've ever seen on a medical TV show?
I can't watch medical TV shows because most of them are just completely wrong. So it's tough. Most shows are.
I equate that to Chicago Fire. They'll go in the fire without a hood on.
Yeah.
It's like, really? Then one person will go in alone. You're like, that's 2 in, 2 out. I'm done. Like,
Yeah.
I'm done.
Yeah, it's tough to watch. It's more annoying than entertaining when you're watching.
For us novices, though,
Yeah.
they're always a blast.
Yeah.
Always a blast. What's the most common thing people say when they find out you are a surgeon?
You look 12. How could you be a surgeon? That's what they most of the time say.
Have you ever been at a party where someone asked you to look at something weird on their skin?
I've been in most places where somebody's asked me to look at something weird on their skin. Yeah, that's a pretty common occurrence in my life.
Is it really?
Yeah, it is.
What's the weirdest thing you ever saw?
Most people that I work with have asked
okay.
me at one point or not to look at something on their skin. I've cut things off of most people that I work with, actually.
That's awesome. That's fantastic. I never would have thought that.
Yep.
Oh, so that was rapid fire questions.
That's it. That was nothing.
That was pretty good. Yeah.
Yeah.
So since you survived through rapid fire questions, my gift to you today is you get to ask me anything you want to ask under the sun.
All right. I got one for you.
Shoot.
Let me get my interviewing. There we go. We'll switch roles here.
This is great.
Yep. So why Alabama?
The University of Alabama for college?
Yeah.
Like I always say it so fast, like a Southerner. My whole family went to Rutgers University. I'm starting off. I got put on the housing waiting list, so we were looking for places to live, right? And around New Brunswick wasn't exactly the greatest of properties available for students. One of my high school football coaches, no, not my father-in-law, the wide receivers coach, his name is Willie Brown. He played at Alabama. I had no idea, right? And obviously Alabama is, no argument, the best college football program in college football ever will be. personal opinion added in, but so he saw me one day and I was just walking to practice and I was like, I just lethargic to practice. He goes, Mike, what's up? What's wrong? I said, well, I told him the whole story. I don't know where to live, I'm just trying to figure out. He goes, I have the school for you. And I'm thinking somewhere in the Northeast. I go, well, what, coach? He goes, University of Alabama. I said, coach, they don't have electricity down there and they're still going to the bathroom in outhouses. I'm like, absolutely not. And he said, Mike, I played football there. So then you go, oh, sorry. Like, I'm so sorry. He paid for my family and I to go down there and check the school out. I fell in love with the university. It's nothing what people think it is up here. My program was ranked 3rd in the country, behind like the Newhouse School in Syracuse for a fraction of the price. As an out-of-stater. I loved it. I have people that I still talk to. My professors were fantastic. I bleed crimson through and through. Oh yeah.
All right.
Roll Tide. Okay. Yeah. Dr. Danise, thank you so much for going off script with us today.
It's a lot of fun.
Fantastic. So thank you all for another episode of Off Script. We will see you next time.